Good afternoon. On behalf of Pella Medical Center and Spartanburg Healthcare System, I welcome everyone and thank you for joining us today. I'm Lindsay Lewis, the Interim Manager of Community Outreach. Our presentation today is titled Master Your Golf Swing, and our speakers are two Titleist Performance golf specialists, Vance Arthurs and Rob Reimer. We decided to do the presentation here at Upward to give these guys enough space to have some exercises and flexibility tests they will perform here shortly. We're very pleased to have these guys join us today for this presentation. Welcome, Vance and Rob. I will now turn the presentation over to you.
Thanks, Lindsay, for having us. With the Masters just over a week away, we thought like it was a great time to discuss ways that you can master your golf swing. At any point during this presentation, if you have any questions, feel free to enter your questions in the chat box, including your email address, so Vance and I can answer any of your questions following the conclusion of this presentation. As Lindsay mentioned, I'm Rob Reimer, and my colleague who will be joining me is Vance Arthurs. We have both been in physical therapy for over 10 years treating sports and orthopedic injuries. We also both hold our Titleist Performance Institute certification, which is a certification directly focused on breaking down the golf swing and evaluating body regions to identify their impacts on your swing faults. I want to highlight a few main points of our topic today. I want to run through a brief overview of the biomechanics and sequencing of the golf swing. I want to review common areas of injury in the amateur golfer. I also want to introduce a 16-point golf-specific screening tool to be utilized as an aid to a standard physical therapy evaluation. And then also want to discuss relevant impairments likely underlying those specific injuries and how they may impact your golf swing. So what's your initial go-to when addressing your golf performance or golf-related injuries? Is it a golf aid to fix that dreaded slice or to improve your swing rhythm and coordination? Or is it a brief YouTube tutorial on golf-specific tips and drills or in a golf magazine? Research shows that amateur golfers spend millions of dollars every year on swing aids, golf equipment, and generic online golf instruction that is not tailored to them and their physical limitations. And yet, when we look at the average golfer's handicap, it's no wonder that we don't see a noticeable improvement in their game over the course of a year. We as amateur golfers initially go to technique-based interventions that are likely not appropriate for our physical limitations. Golf-specific screening may help you identify key limitations that may improve your ability to perform particular movements you're trying to implement in order to correct your golf swing. But it's important to remember that if you're not assessing, you're just guessing. Above you can see there is quite a few moving parts when you break down the backswing and downswing golf mechanics joint by joint. It's important to understand limitations in any one of these areas listed above can impact your ability to produce an efficient and repeatable golf swing, often leading to inconsistent contact and possibly onset of joint aches and pains. There's not one way to swing, there's not one swing style, but an infinite number of golf swing styles. But for each player, there's only one efficient way to swing a golf club based on their physical limitations. As you can see from the pictures above, Matthew Wolff and Rory McIlroy's swing are visibly different. However, both are efficient in creating energy and syncing their bodies to create a reproducible and successful golf swing. Having enough joint mobility and strength is not enough. Proper sequencing of a golf swing is significant in reducing risk for injury, as well as improving your ability to generate power and accuracy. Using specialized golf analysis equipment, we are able to analyze a golfer's swing sequence. As you can see from the picture to your right, the proper swing sequence that we were able to get from the golf equipment shows that the appropriate swing sequence is as follows. The hips movement towards the lead side, initiate the movement on the downswing, followed by the torso, arms, and then lastly the club. Deceleration sequence is also an important part of the downswing's kinematic sequence. Think of this as a whipping type action when you contact the golf ball. From the picture to the right, notice the only segment that doesn't decelerate on the downswing prior to impact is the club head. Here's a picture of both the efficient and inefficient golf swing sequence. So the right here is a graphic of a golfer who has an inefficient pattern and sequence. Instead of his hips moving first, his torso and arms move, followed by the pelvis and lastly the club. This is a very common swing sequence in amateur golfers. Also, you can see by the deceleration sequence, the torso slows first instead of the hips. This particular golfer struggles with slicing the golf ball and is also limited in how much he can play due to left side of low back pain. Here's a graphic from a Golf Digest article which depicts injury complaints by amateur golfers. Overarchingly, the #1 golf complaint is low back pain, followed by left-sided, often lead side, upper extremity issues. This diagram correlates well with the injury rates seen in the most recent golf research. Low back pain and injury account for 24 to 35% of all injuries in professional and amateur golfers. In amateur golfers specifically, they tend to see more low back side bending, shearing forces, which can often lead to more torque experienced. This increased torque can lead to low back complaints, which are consistent with lumbar disc issues. Low back, wrist, and hand make up an additional 13 to 20% of all injuries in amateurs. Some common mechanisms of injury for this injury include abrupt deceleration of the club head, general overuse, and a steep angle of approach to contact the ball. Shoulder accounts for an additional 8 to 18% of all injuries. Lead shoulder most commonly injured, with common mechanisms including decreased torso rotation, increased length of backswing and follow through, and strong lead hand grip. Here's a graphic that shows 16 of the most common swing faults we see in amateur golfers. Without fully assessing a golfer's physical limitations, it's difficult to know the best place to start in correcting these swing faults, especially if a player displays multiple downswing and backswing swing faults. Some of the most common swing faults seen in amateur golfers are over-the-top swing plane, reverse spine angle, S setup posture, and then early extension of the hips. Over-the-top swing plane is one of the most common swing faults seen in amateur golfers. It often leads to slicing the golf ball or possibly straight pulling the golf ball depending on the orientation of the club face. Some of the most common injuries associated with this swing fault are often seen in the low back and elbow regions. Some limitations that can lead to these injuries include poor separation of the torso and hips, limited torso rotation, decreased core strength and control, as well as decreased lead leg control and strength. At this time, I will hand things over to my colleague Vance Arthurs, who will take you through a more in-depth discussion of our golf-specific screening tool.
All right. Hey, everybody. Thanks for being here today. As Rob said, my name is Vance, and I'm going to be talking to you a little bit about a golf-specific screening tool and what are the benefits of it. So why does it matter if you get a golf-specific screen? What's the benefit of having it? Well, we're going to talk about 3 important ones today. So the first thing it does is it breaks down the swing into the physical sum of its parts. Sometimes when a golf professional or a medical professional is assessing your movement, they may not completely understand the whole picture of what's going on if they haven't had training like this, or they don't understand how all the components not only work together, but also how they may compensate when something's off. Using the picture above, if you don't have good left cervical rotation, it's probably going to limit your right thoracic rotation. This means you're not going to make a good turn, and that may result in swing faults like coming over the top or losing your posture and standing up trying to create a bigger turn, which makes returning the golf club to the ball more inconsistent. A golf-specific screen gives us a way to isolate these specific areas so that we know exactly what is causing your swing faults, your pain. Therefore, we can give you exactly what you need instead of just trying a few things and hoping they work. Okay, so the second thing a golf-specific screen can do is to help reduce the risk for injury development. Humans are great compensators. We're able to find ways to do movements or tasks when we really shouldn't be able to do them because of our physical limitations. Ultimately, this is a very useful ability. However, if we perform these incorrect movement patterns long enough, that can lead to pain or injury. In this picture, we see an example of a golfer demonstrating the incorrect posture on the left, which is the S posture, and a correct or neutral posture on the right. So these two pictures don't look dramatically different. And a golfer with a posture on the left may be a very high-performing golfer and have an exceptional swing. But because of the extra torque and compression on his spine during the swing with this type of posture, he could be at a higher risk for having pain or an injury at some point, much like the golfer in our next slide. So the third thing a golf-specific screen can do is assist in progressing back to golf following an injury or surgery. So for those who don't know, the golfer pictured is named Patrick Cantlay. He was one of the best junior or collegiate golfers in the last 20 years. He won multiple collegiate tournaments and was the top-ranked amateur in the world 54 consecutive weeks. He won in only his second start on the Web.com tour, and he was a lock to be an instant success, much like Justin Thomas, Jordan Spieth, and Colin Morikawa. But shortly after turning pro, Cantlay developed a stress fracture in his low back that would keep him off of the golf course for the better part of 3 to 4 years. Shortly after this diagnosis, Cantlay actually went to the Titleist Performance Institute in California with his coach, and they were able to get that golf-specific assessment as well as a swing sequence assessment like Rob talked about earlier, and they found that the forces that Cantlay was generating because of his swing sequence were the forces that were leading to the stress fracture in his back. Cantlay had to work incredibly hard with his therapist and his coach using this golf-specific assessment to not only change his swing pattern, but improve his strength and mobility in his core, his hips, and his legs in order to minimize the stress on his back and hopefully get back to playing golf. So Cantlay still has to arrive at the golf course 3 to 4 hours early before his round to do the body prep work required to perform at his best. But by doing so, he's largely avoided any injuries, and he's risen all the way to a top 10 player in the world. Without his golf-specific assessment and his rehab and instruction teams working closely together, he would have probably had a hard time returning to golf consistently, much less becoming the golfer he is today. So we've talked about it several times to this point, but this is what the Titleist Performance Institute 16-point movement screen looks like. It's been performed on thousands of amateur and professional golfers. It has more research to back it up than any other approach that we're aware of, which is why we trust it so much. These 16 tests are going to look at the mobility and stability of every part of the body related to the golf swing. Issues with one of these areas has been shown through research to have some correlation to the common swing faults that Rob talked about earlier. So if we were going to see you and perform a screen on you or one of our other clients, we put the results in our TPI app. Once we put it into the app, it's going to look like what's on your screen right now. The part on the left is a picture of each of the screening tests, and the dots in the corners indicate how well the client performed each test. Green is good, yellow or red indicates some form of limitation, and a black triangle with exclamation point means that the client or patient has some type of pain with that movement. The part on the right just shows us how likely a client is going to present with one of the common swing faults that Rob talked about based on the results of his or her screening result. So based on this 16-point screen, this app assigns the client with a physical handicap. So just like the golf handicap, lower is better. We're able to compare the physical handicap with their golf handicap and determine where the client is going to get the most bang for their buck when it comes to physical training or golf instruction. So for example, if we had a golfer who had a low golf handicap but a high physical handicap, he's probably a really good compensator and is going to be at a higher risk for developing an issue down the road. Likewise, if he had a low fitness handicap but a high golf handicap, he has the potential to be much better than he is right now and may benefit from seeing a golf instructor in order to be able to harness those good physical abilities into a repeatable, efficient, and effective golf swing. So what we're going to do right now is we're going to run Rob through 3 of the screening tests and the TPI screening, and give you an idea of what it looks like, and to give you something you can possibly try at home to see if you might have a limitation that needs to be looked at. Obviously, you're not going to get as much information from doing it yourself as if Rob or I were to perform it on you, but at least you can get an idea of what's going on. So we're going to head over to the gym now and demonstrate these tests. All right, so first thing we're going to look at is hip mobility or hip rotation. So what we're going to have Rob do right now is come and stand up to this half hexagon on the floor. If you don't have one of these half hexagons at home, what you're going to do is take a 6-iron. You're going to take the 6-iron and you're going to place another golf club on the sole of the 6-iron, and that's going to create the 60-degree angle that we're looking for when we're testing his hip. You just lay it down in front of you and use that as the guide. So Rob, what I want you to do is place your right toe on this line and take your left toes and put it in the arch of your right foot. Okay. So, and then place your hands on your hips for me. Okay. So what I'm going to have Rob do now is rotate as far as he can to the right and then measure how far his hips are moving. Okay, so Rob, go ahead and rotate as far as you can this way. So I'm going to lay this across his hips. And it might be hard to see, but Rob doesn't meet this line on the ground, meaning that he has reduced hip internal rotation on his right hip. This is likely going to lead to a compensation like swaying away from the golf ball, since he can't fully rotate into his right hip. Okay, so staying in this position, Rob, I want you to rotate as far as you can to the left. Okay. And so Rob's pretty close there, so he has pretty good motion with external rotation in his right hip, meaning that his right hip isn't going to affect his downswing most likely. Okay, so now I'm going to have Rob switch and demonstrate the other side. Okay, all right, hands on your hips. Okay, now I still want you to rotate to the right as far as you can, Rob. Okay, so that's right at the line or a little better, meaning that Rob's left hip in external rotation is good. Now I want you to rotate as far as you can to the left. And so it's close, but Rob's a little short on this side as well. So Rob not being able to rotate fully that way means his internal rotation is limited, and he's probably going to have a hard time rotating to the ball, which means he's probably going to slide and make the contact at the ground inconsistent. Right, so now I'm going to have Rob take a seat on this box here, and we're going to look at his torso or thoracic rotation. Okay, so what we're going to do is we're going to take 2 golf clubs, and we're just going to make an X. Okay, you're going to take that and you're going to lay it down in front, and we're going to use this to judge how well Rob's thoracic spine or torso is moving. So Rob, what I want you to do is I want you to cross your right leg over your left and keep your knees together. Okay, now I want you to cross your arms over your chest. Okay, and staying upright, I want you to rotate as far as you can to the right. So Rob has good motion that way. So now Rob, I want you to rotate as far as you can to the left. And that's pretty close. We'll call it even. So Rob has pretty good movement, but if Rob had a limitation there, we're likely to see a disconnect between his upper body and his arms, meaning that Rob is either going to get too fast with his upper body and come over the top, which none of us like to see, or Rob's going to get too quick with his hands and start casting or flipping the club at the ball. All right, so finally, what we're going to do is we're going to have Rob come up here and stand right here for me, Rob, and I want you to hold your arm out. We're going to look at wrist flexion and extension. So with Rob's arm straight out like this, I'm going to take the 6-iron again, and I'm going to hold it equal to his arm, making sure that the angle of the golf club is equal to his wrist joint. And from here, I'm going to have Rob flex his wrist down for me as far as he can. Okay, it might be hard to see, but Rob is right there with it, or if a little bit past. So Rob has good wrist flexion. So now we're going to take the golf club, turn it over, and have Rob try to extend his wrist as far as he can go. Okay, and so again, right there or a little bit past. So Rob has good motion and flexion and extension. If Rob had a limitation, that's usually going to result in someone having a hard time controlling the club face during your golf swing. So they're either going to get up here at the top of the golf swing and come down and not be able to flex their lead wrist, meaning that the club isn't square at impact or it's really open, resulting in that ball going away to the right or left if you're a left-handed golfer, or he's not going to be able to square it by bringing it back down. So what we're going to do now is we're going to head back and do a few more slides on the presentation to finish up. We hope you enjoyed these demonstrations.
All right, thanks fans for those demonstrations. Hopefully those of you watching can utilize those examples to assess yourself and see if you wouldn't be somebody who may benefit from a more thorough 16-point golf evaluation. So certainly without assessing physical limitations, the newest clubs, the best swing coach, and the best swing aids alone are likely not going to get you where you want to be in your golf game. So what's the next step? We would encourage you to seek out a medical provider and see if you can't get a script to come in for a TPI screen and physical therapy evaluation. This will really help us to address those areas of pain and limitation while seeing what areas of limitation are affecting your swing faults that you're currently seeing. But what if you're somebody who's not experiencing pain? You would also still benefit from a TPI screen, but may also benefit more from golf-specific training. So if you're looking for improvements in strength, power, and endurance to see an improvement in your swing speed or golf ball distance, this might be an area for you. We work closely with our partners at SMI Sports Performance, led by Gary Hazelwood. And if you are interested in seeking more information about what they do, there's the email address on the screen, or you can call at that number. We will provide this information for you in a follow-up email after the end of this presentation. So just a couple key take-home points from our presentation today. It's important to remember that if you're not assessing you're just guessing. So receiving a more formal golf screening from a certified professional will likely help you make the necessary swing changes you and your golf professional are trying to make. Also, by addressing your underlying issues, you'll likely see an improved ability to play golf more frequently, improvement in your overall golf performance, as well as a significant reduction in the intensity and frequency of symptoms if that's something that you're experiencing. Also remember, the medical professional collaboration with your golf professional is a key part in addressing both the physical as well as the technical limitations underlying your swing faults, which may allow you to change your injury-inducing swing mechanics. And then lastly, proper golf-specific strength and conditioning after a golf-specific screen will also reduce your future risk for injury. It will also have a positive impact on your swing speed and distance to give you the tools to see improvements in the consistency of your contact and ultimately your score. Here's a link to the Titleist Performance Institute website if you're interested in finding out more information about the 16-point golf-specific screen or just other golf-specific strength training tools and instruction. You can go to this website at mytpi.com/about. Or if you're interested in finding other medical professionals like Vance and I, you can go to the website mytpi.com/experts. You can also find certified fitness professionals who are also certified in the Titleist Performance Institute screening if you're looking for more of a golf-specific training program. Here's our contact information. You can email us directly at our work emails here on the screen. We will be sending this out in a follow-up email along with the links in the previous slides. Lindsay will also be sending out a survey so that we can receive feedback on our presentation today, and then also include areas where you want to see more golf-specific topics presented. This will really help us plan in the future and how we can get you more information on this particular topic. Well, hopefully this presentation will have a positive impact on the future direction of your golf game. We certainly appreciate you joining us. Thank you.